No dice.
No chat. So.
Do you want me to go get him in that?
Yeah, it's you're live. But there's no chat box.
I've got you as live on YouTube.
Do you see a chat box? I have a little monkey off to the right that says something went wrong.
All right, so no chat box.
You don't have it either. Okay, all right.
But you are streaming.
Okay, good. So we'll just need a little bit more. Yeah. So I'm guessing that means, and when Brian brought it up, you can't get, there is no chat box on here either, so I'm guessing that means we're not doing that today.
You could try to shut it down and go back again.
We're on the clock. Nikki's got an 8:30.
Okay, all right, we're gonna go ahead and go then. Thank you. Yep. Okay.
Ready to go?
Yep.
Okay, good morning. This is the Personnel and Human Services Committee of the Berrien County Board of Commissioners with our February 11th meeting. If we could have the roll call, please.
Commissioner Harrison?
I'm present via Zoom from Lincoln Township.
Commissioner Majerick?
He's coming.
He's coming,
He's
okay.
coming, he's not quite there yet.
Commissioner Bell?
President via Zoom, City of St. Joseph.
And he's almost connected. Okay, go ahead, Shelley.
Commissioner Majerick, we're doing the roll call?
I'm here in Niles, Michigan, zooming.
Okay.
Hey,
Mr.
this
Chair, you have-
morning, on our agenda, we've got first up is the director of our health department, Nikki Britton. She'll give us an update on COVID and some of the things that they're dealing with, and also talk through a couple of the resolutions. So Nikki, the floor is yours.
Do you have a particular order? Would you like to do resolutions before update or?
Whatever you're comfortable with.
Okay. We'll go through the resolutions. So resolution 152 is here. This is a fairly standard agreement that we have entered into with the Fair Food Network for the Double Up Food Bucks program. For those of you that might not be familiar with this, the Berrien County Health Department does operate the Benton Harbor Farmers Market, and part of that operations is we have infrastructure in place to be able to accept food assistance benefits at the farmers market. So the Double Up Food Bucks program allows somebody to spend their bridge card dollars at the market and receive matching funding. So if somebody wants to spend $10 from their bridge card, they would receive $10 off their bridge card to spend at the market, but then another $10 from the Double Up Food Bucks program, allowing them to buy $20 worth of produce at the market. This is probably our 7th year of participation in this program. It's not a large sum of money, but it's the $2,500. Every one of those dollars is used for matching bridge card purchases at the farmers market.
Any questions
you're on mute.
about that?
Nikki,
Yes.
can this be used at other markets in Berrien County, or is this specifically Benton Harbor?
So this award is specific to the Benton Harbor Farmers Market, but there are many farmers markets across the state that enroll in this program. So if there are other markets in our county that wish to be part of this, they could work towards that.
Okay, good question, Mike. Ray, any questions of Nikki?
No, not this far.
Okay, Nikki, go ahead with your next one.
Yep, so this next resolution is about, it's an amendment to our comprehensive agreement. And so local health departments have a big contract with MDHHS, Michigan Department of Health and Human Services, where our funding and contract for programs that are funded by MDHHS flow through. That's called the comprehensive agreement. The fiscal year for the state and for all the funding for these programs is October 1 to September 1. And periodically throughout that fiscal year, we do get updates and amendments. There's usually 5 or 6. So it's pretty par for the course that we're on Amendment 2 right now. This is just showing some changes in some programs as it's outlined there in the resolution. There was an addition of $133,000 for COVID vaccine activities. We were given an award notification of this back in the fall, but it's taken a time to get into that official contracting process. There was also an award of $65,000 to support our water filter response in the city of Benton Harbor in response to the action level exceedance that city has been under for a couple of years now. There was some carry forward of funding in the tune of $189,000 of emergency preparedness funding from fiscal year 20 into fiscal year 21. And then there's some other jockeying of programs. So there was additional money under home visiting that was added, some additional money under WIC breastfeeding. There was a known reduction in the Michigan Adolescent Parenting Program of $155,000, and we have been operating under that new budget since October 1, and a couple other little things in there. So this brings our grand total of our contract for the comprehensive agreement to $5,035,001.
Okay, the questions of Nikki about this resolution. Okay, is it okay if we do these at one time? The keeper of the records.
Sorry, go ahead.
Yes, that's fine. We'll just have a motion at the end to move the resolutions forward for full board action.
Okay, great. Nikki, the next one.
Yep, so the next one is 154, and this is to accept funding of a grant award from LARA, and this is a continuation of a program we've had in the past as well. I think this is probably our 3rd or 4th year of this funding, but each year LARA wishes to contract and provides grant awards with local communities to do education, communication, and outreach. It is geared towards medical marijuana, but there's overlap with recreational marijuana messages in there and how to ensure that legal use of marijuana is happening safely and still protects children, and that pregnant women understand the impacts of marijuana. So we have, in previous years, have developed informational campaigns and some awareness campaigns for individuals to just understand and have all the facts about marijuana use and when it's appropriate and when not, and all of that. So this is an award to continue that work in fiscal year 21 to the tune of $48,220. So we are asking for acceptance of this funding.
Okay.
Any questions of Nikki?
Nope.
Okay, moving right along.
All right. So this next one, things are a little bit unusual in times of COVID, but 166, this is actually an update to the amendment in the second resolution that I brought to you in our comprehensive agreement. So 153 is currently in process, and this would be an update to it because more information has become available to us. But we did find out this week that we have been awarded $691,000 from the state of Michigan for part of our COVID-19 vaccination response. And it can include things like staffing, communications, and other supplies. So we would like to be able to accept this funding as well. And that brings the grand total of the comprehensive agreement with this addition up to over 5.7 million.
And so a significant investment into what's going on by the state and the federal government. Great.
Absolutely.
Are you pleased with the amount, the 691? Does that seem reasonable to you?
It does. It probably won't cover everything, but it's a really good chunk. And the fact that money had been trickling in smaller quantities of 60,000 or 100,000 to see several $100,000 at once has definitely been encouraging.
Good. Questions for Nikki, Ray, or Mike?
What else? I guess what dollar amount are you lacking to cover everything?
So it's hard to say that there's we need X dollar amount because the situation changes and the response changes so rapidly. Just to give you a general idea, we're spending about roughly about 50,000 a week on salaries for staff for these vaccination events. I mean, many of our events, and it takes a lot of staff to be able to make these things run. We do have other funding from some CARES Act dollars and things that have carried forward, and some other state pots of money. So this definitely gives us more assurance we'll actually make it to the end of the fiscal year. We had been really watching our projections very closely previously. So this gives us a lot of confidence, but at the rate we're going through that, I mean, that's a few months worth of salary and fringe. We are also doing things on the backside to try to reduce those costs. And as I'll get to in a little bit with my update, we've been utilizing more volunteers. So it's one of those things where we're definitely not currently spending money on communications and outreach materials. And if we were to have more of a budget to be able to do more of those things, that would help. But our primary concern is making sure we also have the human resources to make the activities happen.
Okay. Thank you for that.
Would this cover our contact tracers and follow-up people?
No, we have some separate CARES Act funding that covers those activities. The way the money has been coming, it's been somewhat siloed within COVID response. So it's not like block grant where you apply it however you want. It sort of comes with specific functions. So this is specific to vaccination efforts.
And this does not anticipate any additional money coming from the federal government to support COVID response under the Biden administration?
I mean, it was allocated from the state general fund, is my understanding. So I'm not sure if that was done thinking it would be supplemental to something from the feds or in place of. I'm not sure.
Okay, any other questions of Nikki?
Yeah, Nikki, so the government is giving you lump sums and they're not providing money per shot. It's based on, here, you get this amount of money, use it up, and then come for more. So it has nothing to do with each shot that you're receiving. We're not paying for the shots, correct?
Correct. It's a federal asset. The federal government has purchased it. So any of the vaccine that comes into our county or any other local jurisdiction is coming through that public market. It's a federal asset. And no, there's no reimbursement to us from the government, from the state on a per shot or per dose administered. It's a lump sum, and they have some funding formula they use how they determined each health department's allocation.
Okay, any other questions of Nikki? I'm hearing none. How about a resolution adopting all four of these resolutions?
I'll make that motion adopting these last four resolutions.
I second.
Okay, any further discussion? We've got a motion to accept all four of these resolutions. Mr. Administrator, do you have anything to add?
No.
Okay, could we call the question and have a roll call, please?
Commissioner Majerick,
Yes.
Commissioner Bell,
Yes.
Commissioner Harrison.
Yes.
Mr. Chairman, you have 3 yeas.
Thank you. The motion then passes. So now we'll go on to the COVID update, Nikki.
Yeah, and I'd like to share my screen. Okay, perfect. Thanks, Nat. So I'm going to go through this slide deck fairly quickly because I want to make sure that we have time for answers. I give a similar sort of update to the EOC committee of commissioners that meets weekly as well, but I wanted you all as our parent committee to have an understanding of some of the things that we're tracking and where we're at with vaccination as well. This graph shows the number of cases over time throughout the course of the whole pandemic. the thing that's really important to look at right now is down here, we're seeing a continued decrease in the number of cases. So we're down to an average of about 25 new cases per day. That's really encouraging from a transmission standpoint. Our percent positivity is below 7%. Again, that is a good sign, and we want to see that continue to drop. But it's really good. The data is going in the right direction. And the number of tests that are happening for COVID-19, of course, there's a little bit of fluctuation. There's changes in demand, and different types of testing becomes available or isn't as available. But on the whole, we're averaging several hundred tests, 5, 6, up to 800 tests per day are happening in Berrien County. And that's really great that our residents have access to that as a resource, as well as it allows us to know how much of the disease that's out there are we truly capturing. So we're feeling like we're in a really good place with that. This data continues to be really important to track. I know a lot of focus and attention and hope is on the vaccine, and rightly so. But with the new variants that we're finding, our partners in the Cass Van Buren Health Department issued a press release, I believe earlier this week, that they had identified or confirmed one of the variant strains from the UK in a resident in that jurisdiction. It's safe to assume we probably do have that variant strain circulating in Berrien County. It's been found in over half the states in the country. It's circulating, and it doesn't necessarily cause more severe illness. The illness profile is about the same if you're infected, but it is more transmissible. So it's more likely to spread from person to person than what we were seeing in the fall. So with that in mind, it's really important that we continue to monitor what's happening, because all it takes is about 2 weeks for some numbers to start doubling, and then you can quickly get out of hand. So we're paying close attention to these numbers. We want to continue to encourage our residents to pay attention to social distance, avoiding large crowds, wearing masks. All of those things still matter, and those are our best tools for curbing transmission right now. The vaccine is a long-term investment. It will pay dividends in the months to come. We'll see a lot of that probably in late spring and into the summer. But right now, all of those practices that we've been preaching since March, last March, continue to be our best insurance. But with all that being said, the data does look encouraging. We're always, perhaps could have an upward trend, which is why we have to be diligent. This graph shows the average number of people in the hospital with COVID-19, a confirmed COVID-19 case. So we've seen a really good decrease here. That mirrors what we saw in our decrease of cases and our percent positivity. There's a little bit of flattening. This is good. The healthcare system is in a good situation to have the resources to be able to provide adequate care to those with COVID-19, as well as other health conditions. And this is probably our best canary in the coal mine to tell us how things are going. One of our main response goals for COVID-19 remains to protect the healthcare system and ensure that there are enough healthcare resources to provide healthcare to everyone who needs it, regardless of cause. And this graph, it jumps around a lot. This is the number of deaths amongst Berrien County residents associated with COVID-19. And there were more deaths that were happening in November and December, which followed that big increase in cases that we had. We are starting to see a tapering off. There's been a bit of a decline. There are still deaths happening, as there are hospitalizations happening, but we're seeing it in fewer numbers. So that is encouraging. We can't let up on our diligence in those protective measures. And again, the protective measures of social distancing, mask wearing, avoiding large crowds, avoiding close contact with people, those remain a very, very important tool as we're working on vaccine rollout. So with vaccine rollout in mind, and the fact that we've got to pay attention to these other things, we had the question about case investigation and contact tracing. That remains a really important tool for us as a health department. I just wanted to share briefly, as of this week, we've kind of been in this for the last month or so, but this is part of a weekly update I've done for our team. The health department is really doing work in 6 buckets. And not all of these are resourced the same. Some are heavier, but we have a very heavy focus on COVID-19 vaccination, as we should. It's a lot of work to ensure that our residents get access to the vaccine, and we're getting 90% plus of vaccines into arms within 1 week of receipt. We are not sitting on vaccine. We're also making sure that our vaccination efforts have an equity lens, and that we are not trying to do a one size fits all approach, because one size fits all does not work for everybody. We know that there are people who have all sorts of issues accessing healthcare, accessing the internet. So all of our processes cannot be driven by internet. We know that there are transportation barriers to getting to sites, so we want to make sure we're on site. So I can talk more in depth about what that looks like if you'd like. But so we've got a lot of focus on COVID-19 vaccination. We have dedicated staff that are still doing case investigation and contact tracing every day. That remains a really important tool for keeping transmission low. We're fielding lots of inquiries and trying to provide as good a customer service as we possibly can to our community through our hotline, through lots of communications out of our department and with community partners, and really just fielding lots of information about appointments. But then it's also important that we are devoting time to core response and planning, because this is a constantly evolving situation. We don't want to be in a reactive posture. We want to be able to be proactive and anticipate what's coming and have good plans for that. We also have programs that are just running, some of them not quite business as usual, but we have many of our programs that are continuing to run, albeit at a reduced scale and with reduced staffing levels. But there are other essential services that we provide as a department that we're continuing to do so. And then there's also just all the support around outbreaks that are happening of COVID-19. So those are our main buckets of work, and we're making sure that we have resources to fit all of these categories. It's a lot of juggling for our staff, and many of our staff are in multiple of these buckets and in shifting gears, but they're doing a tremendous job juggling this large amount of work. Now, in terms of vaccine administration, so far, and this does not include, there were 300 or 400 doses of vaccine, I believe 400 doses that were administered yesterday, not included in these numbers. So we're up to about 9,500 doses of vaccine that have been administered by our department, basically since the end of December. We do have 2/3 to about 75% of those vaccines have gone to adults 65 plus, and that's within the ratio that the state is expecting from us. And that represents, yesterday was a first dose clinic, so that represents we've got about 8,300 people that have received their first dose of vaccine. And we've got many more second doses coming along. And throughout the month of February, that second dose number is really going to go up. We have found it very important to have a balanced portfolio of vaccine clinics, and how we're doing that, as I spoke about a little bit on the previous slide. We have to do this in a variety of ways to make sure we're capturing everybody's needs. This is too important of an activity for people to be left behind because of some structural barrier that exists. So we have large scale clinics that are happening primarily in our office space, because that's one of the best locations or the best facilities we have available to us to be able to do that. We can get approximately 1,400 people through in a 10-hour day at our Benton Harbor office. And when we've had those large scale clinics, we've focused on healthcare workers, the essential workers, and adults that are 65 plus. We've also held drive-through clinics, because there are some people who, for a variety of reasons, would prefer to have that option. These have been held at firehouses throughout the county. So we've had some great partnership with fire departments hosting us and being able to do a drive-through, but in a somewhat covered area, which is very important when we have weather like this in a Michigan winter. And those have been very well received. And we're also doing what we were referring to as pop-up clinics, where we're going to people in trusted, close locations. So we have a lot of senior centers scheduled. We've been to a few already. We've gone to subsidized senior apartments where people have had transportation barriers, or we know that there's a higher incidence of some chronic disease and some mobility issues. We've had pop-up clinics at churches, and it's really been very important that we're working with trusted leaders in the community as we do these pop-up clinics, as we arrange for them, as we figure out where they should be, how to communicate, get people registered about that. Really working with our partners on the ground is absolutely essential, because we want the community to be able to be in a place where they can trust what's happening, have familiar faces. This is a scary time. Getting the vaccine can be very scary and anxiety provoking for lots of people. Being in a familiar place, seeing familiar faces, seeing people there really goes a long way to helping make people comfortable. So those pop-up clinics are an essential part of our strategy. And then we've also been doing some on-site facility clinics in long-term care, congregate living situations. Many of those types of facilities have been matched through a federal contract with a Walgreens or a CVS pharmacy to be able to do those, but not every facility has. So the health department has been very active at getting into those locations to make sure those vulnerable residents are covered. And then just to give you a little taste of what's on the horizon. So starting this week, we've gotten into really getting our educators and school staff, childcare and child protective services, adult protective services workers are also some of those essential workers that we're working to bring into the fold later on. There's been a lot of effort with Homebound, but we're looking to ramp that up. Spectrum Health Lakeland has been a great partner with that. And then continued focus on our seniors. And then thinking forward, we're really just anticipating a lot of the changes in the landscape that are coming with more pharmacies coming on board. We know our federally qualified health centers are going to be coming on board as providers sometime soon. We know we want to have more of a presence with large clinics in Niles, because that's a very important population to make sure they have ready access to something locally. And then there's going to be more people that will become eligible for vaccine in the coming weeks. That's going to be a struggle if vaccine production doesn't ramp up enough that it gives us even more of a vaccine allocation than we currently have. But we're really planning forward. We have plans in place because we know it's coming, and we want to make sure we're ready to serve our residents and make this as smooth of a process as we possibly can, even though there's lots of bumps happening behind the scenes at the federal and state level. So I'm happy to take any questions.
I believe you have an 8:30 meeting now.
Yep, I can give about 5 more minutes here.
Okay, great. Questions of Nikki?
I know you've used Niles Township Fire Department as a drive-through.
Mm-hmm.
Have you used Niles City as a drive-through yet?
We have not, and I don't want to speak. I know there's been some looking into it, and I think there. I don't know exactly what the constraints were. I think there were some constraints with how the parking lot was structured to have the correct flow, but don't quote me on that. But I think that might have been something that we were thinking about.
Nikki, you mentioned the variant. I just wanted to know if that variant, how does that affect, the current vaccines that we have now? Like, do those work still with that variant?
Yeah, that's a great question. So with the UK variant that I was referring to that has been seen really across the country, the mutation does not seem to have affected the spike protein on the virus, and that's what the vaccine is targeted. So right now it seems like there is still very good coverage from the vaccine. Now there are a couple variants that have been identified elsewhere in other parts of the world and not widespread in the United States that might reduce the efficacy of the vaccine somewhat. The good news about how these vaccines have been developed is that they can easily be modified to I'm stumbling over my words here. They could be modified to be able to target a different protein. So if a certain protein mutates, the vaccine can then be updated. However, if that were to happen on large scale, and we are not on the brink of that right now, obviously the administration of another booster dose to people who have already been vaccinated would incredibly complicate things. So we are not at a point where that needs to happen. People who have been vaccinated still have very, very, very good coverage of the even with the known variants, but that's something that the research community and the medical community were watching to make sure we can stay on top of.
Okay. And I just wanted to thank you, Nikki, and the health department for all that you do. We know you guys are working hard.
Thank you so much. We appreciate that.
Other questions of Nikki? If not, Nikki, you might also talk to Lake Michigan College, their Niles campus, with the bulk of what they're doing being virtual. It might work out, based on the traffic flow or whatever, as well as having an indoor facility that you would be able to use. So you might talk to them.
Talks are underway.
Great. Okay, if not, then we'll let you leave. Appreciate all that you and your staff are doing. Great leadership from you and great hard work from your staff. So we really do appreciate it.
Thank you. We appreciate your support. Take care.
Thank you. We'll go on to our county administration, our committee business now. The first item on our agenda is reviewing our minutes from our meeting on January 28th. I assume everyone's had a chance to eyeball those. Any questions about them, Ray or Mike?
No, I make a motion that we accept the minutes from last time.
I second that motion.
Okay, we've got a motion and a second. Any discussion about the motion? If not, could we have a roll call, please?
Commissioner Bell,
Yes.
Commissioner Majerick,
Yes.
Commissioner Harrison.
Yes.
Mr. Chair, you have 3 yeas.
Okay, then we'll move right along in.
Actually, if I could interrupt you for a moment, I'm sorry. There was one resolution that's added, and Annette is sharing the screen right now, and I can speak to it with some help from our administrator. Resolution 164 is on your screen, and the sheriff has a vacancy in the emergency management technician position. This is a position that is out at the EOC. Very vital position. So whenever there's a vacancy, we always ask the department to look at that vacancy, make sure the current job description fits. Is there more duties that need to be assigned? Is there better technology that can be employed? Is the position even still needed? So Brian and I met with the sheriff, the undersheriff, and the captain of emergency management. We walked through everything, developed a more appropriate job description, and came out with a new job description for an emergency management specialist with more higher level duties than had previously been assigned. We've run this through the union. The union concurs with the change. So we're asking for your approval to move this to full board action then. So that we can make that complement change and get the position posted and start receiving applications for that vital position.
So this results from a retirement then?
No, it was just a movement within the sheriff's office. The former individual transferred to a different position.
Okay. Any questions of Shelley, Ray, or Mike?
Nope.
No, Shelley, and thank you all for doing this, but I'd like to make a motion that we accept this resolution.
I second that.
Okay, we've got a motion and a second to move this along through the process. Any further discussion? Hearing none, could we have a roll call, please?
Commissioner Majerick,
Yes.
Commissioner Bell,
Yes.
Commissioner Harrison.
Yes.
You have 3 yeas.
So the resolution is passed and it'll go forward to the board. Will that be at the next meeting?
It's scheduled for the 18th at full board action.
With the
So next week.
Okay. With the other resolutions for the health department, are they on the schedule for the 18th also?
Yes.
Okay. That answers the question. So we've got the minutes approved. Now we're going to go into the pension related activity. And Shelley, you're going to do the honors?
Actually, okay, Annette is sharing a screen about how to do the public comments too, just to let you know. Go ahead, Annette.
So to the public that is watching, the Personnel and Human Services Committee meeting on YouTube. The chat option on YouTube is not working for us today. So we have to do public comments in a different way. So there's two options. Viewers will need to go to Zoom, the website zoom.us, or to the Zoom app if they happen to have that loaded on their computers or phones. And the information that you need to join the meeting is listed there, meeting ID and passcode. The individuals will be providing their comments in the chat box on Zoom. They won't actually be speaking in the meeting itself. The other option is you can email my email address, akrieger@berriencounty.org, and those public comments will be read. And I just want to remind everyone who wants public comments read that they need to provide their name, the municipality that they are from, and then their comment. And I'm going to go ahead and leave this up for the remainder of the county administration portion of our meeting. Thank you.
Do we have anybody watching?
16.
Great.
Yes, we do.
I think that's the largest number in quite a while. So, okay, so shall we go to the monthly pension refund rollover request?
Yes, you were sent the monthly pension refunds and rollover requests yesterday. Just to refresh memories, these are individuals who are no longer employed with us, and they are simply requesting either a refund or to roll over the pension contributions that were deducted from their payroll checks while they were active employees. And I'll try to answer any questions that you have.
Questions from Ray or Mike? So these are it's their money, not the county's money. And so
That's correct.
They were making contributions into the pension. Okay.
That's correct. And none of the individuals on your list were vested, so this is their only option, was to take the refund or request the rollover.
Okay, any questions, Mike or Ray?
I have none.
Okay, could we have a motion? Do we approve these then, Shelley?
Yes, a motion is necessary.
I'll make a motion that we accept both of these.
Second.
Okay, we've got a motion to accept the retirement refunds. Any further discussion? Okay, roll call, please.
Commissioner Bell?
Yes.
Commissioner Majerick?
Yes.
Commissioner Harrison?
Yes.
Mr. Chair, you have 3 yeas.
So the resolution is passed and the refunds are authorized. Okay, moving on to the next item on our agenda, and that will be retirement.
Yes, typically retirements are approved on a quarterly basis, but last year with the advent of COVID and infrequent PHSC meetings, that did not occur. So we're asking for one annual approval of all the retirements from last year. They were sent to you in advance. I will try to answer any questions that a committee member has.
Questions, gentlemen?
Nope, I have none.
And to clarify, the AME column is the average monthly earnings?
That is correct. That's an average over the highest either 5 or 3 years of compensation, depending upon bargaining unit affiliation.
Okay, so our role is to approve these then, and we'll be doing this on an annual basis or quarterly? Or?
Actually, no, we'll go back to a quarterly basis, provided that we have more frequent and routine meetings.
Okay, is this pretty much pretty standard number of retirements that we see on an annual basis?
It varies year to year, but anywhere from 30 to 40 is usually pretty typical.
Okay, any other questions of Shelley about the list? So we need a motion.
Make
Please.
a motion that we accept these.
Got a motion from Mike and a second from Ray. Any further discussion? Let's call the roll, please.
Commissioner Majerick,
Yes.
Commissioner Bell,
Yes.
Commissioner Harrison.
Yes.
Mr. Chair, you have 3 yeas.
So the motion is passed and the retirements are authorized.
Thank you.
On the agenda is, the next is a resolution regarding an interim road department director. I believe Mr. Doucette will cover that for us.
Yeah, so members of the committee, this is a requirement for the placement of any interim director. It's got to be formally approved by the Board of Commissioners. That's something that I'll be asking the board to do later today. As part of that, I know that we have multiple members of the public that are keenly interested in our road department and have comments to offer. As it relates to the director's position, on the personnel side, that's something that I'm not going to comment on, and I would encourage the board to refrain from any personnel-related comments. What this is a short-term placement of Mr. Neil Colston into the road department, allowing him to handle the day-to-day operations. Neil has made very clear to me that he does not have any desire to be there more than between 2 and 3 months, and he's working between 20 and 30 hours a week. When he's not there, I'll be in regular contact with the department heads. As it relates to the ongoing personnel review for the current director, again, that's something that I cannot comment on.
Okay, questions of Mr. Doucette, Ray or Mike?
I have one question. So as you stated, Mr. Administrator, there are leaders of the public who have a desire to, comment on the situation. I had a question from one of our community leaders asking if this particular, I guess, placement of an interim director, can it be tabled or can it be postponed until the community has an opportunity to express comments on this?
So I received a similar text message from a local official with Benton Township. I would encourage the committee that they're 2 separate issues. We need day-to-day management in place while the personnel issue is being reviewed. And the way that I view Mr. Colston's job right now is really as a placeholder to ensure that paperwork is being filed and that projects are progressing. Mr. Colston has made very clear to me that he has no desire to be the long-term road department manager, and these need to be separated. There's got to be short-term staffing in place to ensure the day-to-day operation while the long-term personnel review is conducted. They are 2 separate issues, and I know that it's easy to see a potential tie bar between them, but I would encourage the board to recognize these are 2 separate issues.
Okay, so at a later time or opportunity, the members of the public will have, opportunity to express themselves, right?
Absolutely, and with respect to the public, that's already underway. In the last several days, there's been outreach from a variety of members of the public, from township officials to residents to even members of the road department staff, reaching out directly to the Board of Commissioners. And that's underway, that's not going to stop. And from the administration side, we absolutely embrace everyone's right to weigh in on the subject. But at its core, administration cannot and will not discuss internal personnel issues.
Okay. Well,
Oh, I can't, oh, hang on, hang on. Hang on. Oh, goodness. There you go.
Okay, can you hear me now?
Yes.
Yeah.
I make a motion that we accept Neil Colston as the interim director and would like to push forward the resolution.
I second that.
Okay, we've got a motion and a second to recommend to the board the approval of Neil Coulson as the interim department head for the road department. Any further questions or discussion? If not, let's have a roll call, please.
Commissioner Majerick,
Yes.
Commissioner Bell,
Yes.
Commissioner Harrison.
Yes.
Mr. Chair, you have 3 yeas.
Okay, if I can interject, Commissioner Majerick, would you go ahead and unmute yourself now? And then you guys, if you could please leave yourselves unmuted, and then I'm gonna make a change in our settings. 1 second. Okay, now you can go ahead. Thank you.
Okay, so the motion is adopted, and we'll discuss that at the board meeting later this morning at 10:30.
Anything else then?
Pretty young.
Oh, Mr. Chair, we also have the addition of a per diem resolution.
P2102002.
That number is P2102002. I believe Annette sent that to you.
Did not see that, so could you review that, the particulars? Did Mike or Ray, did you see that?
I did not see it.
Yeah, I believe I did. Yeah.
Yeah, I think that was no from all 3 of us.
Oh, okay, I'll have to send it.
Okay,
again.
Annette will
I did read about it, but I looked for it and I couldn't find it.
Okay.
Because I saw it was on the agenda.
All right, Annette will resend, and then you can just act on that at the full board meeting then.
Okay. What's it in relation, what are we doing with the per diems? What?
It's just the standard monthly per diem payments to the commissioners for board meetings.
Okay, all right. Okay, are we ready for public comments then?
We are. Okay. This one is from Emily Boehm, B-O-E-H-M, from Lincoln Township. Thanks for having me today. I am wondering why Jason Latham was fired. The next comment is from Kelsey Schoenwitz, S-C-H-O-E-N-W-I-T-Z. Why was Jason Latham fired? I understand you can't discuss personnel issues, but why is everyone kept in the dark without any indication of reasoning? I'm sorry, she is from Stevensville. And then stand by. This is from Debbie Boothby. She says, I am the treasurer of Benton Charter Township, and her address is in Benton Harbor. My comment this morning regarding Mr. Latham's administrative leave, I respectfully ask that the local municipalities be allowed to meet with the Personnel and Human Services Committee and administration to set so as to voice our concerns regarding Mr. Latham's employment. Okay. I believe you're good. I have another one, but that's for the VOC. I will read that at the 10:30.
Okay. So that's all the public comments?
That is correct.
Okay. Is there any other business for us to conduct this morning?
No, sir, I believe that's it.
Okay, well then, the meeting is adjourned. Thank you all for attending. Thank you for those citizens that were watching on YouTube and participating and sending in your comments. Thank you. The meeting is adjourned.